In 1994, the Cairo Conference on International Population and Development maintained that both contraception and HIV were important to women's sexual and reproductive health. Therefore, the Preventive Technologies Agreement, building off of this momentum, has had as part of its basic objective the integration of family planning and HIV services.
The family planning and HIV fields naturally intersect in so many ways. Women and girls all over the world are at dual risk of both unintended pregnancy and risk of HIV acquisition. Integrating family planning and HIV services, it can enable women who are living with HIV who do not want to become pregnant to prevent that pregnancy. It can enable women living with HIV who do want to become pregnant to have access to services that will allow them to have a safe and healthy pregnancy and delivery. At FHI 360, we've really taken a multidisciplinary approach to this issue of family planning and HIV integration.
In the biomedical arena, FHI 360, through the Preventive Technologies Agreement, has evaluated not only the role of modern contraception in HIV-infected women, but has also evaluated whether or not the antiretrovirals that these HIV-infected women are taking affect the metabolism of their contraceptive choices.
So the behavioral research that we implemented under the Preventive Technologies Agreement in this area of family planning and HIV integration was really focused on understanding the contraceptive needs and practices of key populations. So for example, we did a study in Bangladesh trying to better understand what are the family planning needs of female sex workers and injecting drug users. The programmatic research that we conducted was really focused on generating evidence of feasible, effective, and cost-effective models of delivering integrated family planning and HIV services, both in clinic contexts and community-based service delivery contexts. So for example, in Tanzania, we conducted a study whereby women accessing HIV care and treatment services were screened for whether they had an unmet need for family planning, and if they did, and if they desired to obtain a contraceptive method that day, they were escorted to the family planning clinic on site and able to obtain a method that day. And the study demonstrated that this was in fact a feasible and effective way to increase access to contraception for women accessing HIV care and treatment services.
The Preventive Technologies Agreement has also emphasized research utilization as key to using the evidence that this agreement has generated.
We did have a very robust portfolio of research utilization activities, and those were designed to ensure that the latest evidence on family planning and HIV integration was packaged and synthesized for global health policymakers, donors, opinion leaders, program planners, and implementers.
The Preventive Technologies Agreement has also emphasized the fundamental role of youth in the future of sexual and reproductive health. Specifically with regard to family planning and HIV integration, it's crucial that youth who are seeking family planning services know their HIV infection status. If they're uninfected, we can counsel them on ways to stay uninfected. But if we find out they're infected, we can get them into HIV care and treatment services.
Under the Preventive Technologies Agreement, some important work was done related to youth sexual and reproductive health in the area of knowledge management. So one of the major contributions is the work that FHI 360 has done under USAID's Interagency Youth Working Group, or the IYWG. Another example of work done under the Preventive Technologies Agreement would be Youth InfoNet, which is a monthly synthesis of new research and evidence on youth sexual and reproductive health. So one of the things that we heard loud and clear from young people in the field is the need for provider resources that address the needs of young people living with HIV. So we developed a new resource in collaboration with UNICEF and WHO called Positive Connections, which is a support group guide for young people who are living with HIV, and an outpouring from the field for a need for this sort of resource, and we've received a lot of requests already for dissemination and for training.
When we talk about family planning and HIV integration, what we're talking about is really breaking down the silos that have historically existed between these two programmatic areas so that we can safely and more effectively meet the sexual and reproductive health needs of women, men, and adolescents.